Hi, this is Dr. Jun Reyes, your physical therapist and also vestibular specialist. Bago tayo magsimula sa topic na ito, please make sure na mag-subscribe po tayo dito sa subscribe. Yan, dyan po. Dyan, please subscribe po. And hit that thumbs up. Alright, thank you. Vestibular specialist. Ibig sabihin po ng vestibular specialist, kami po ay mga physical therapists na nagtitreat ng mga patients with dizziness, gait and balance problems. Okay, so ang topic natin, bakit ba tayo nahihilo? Ano ang mga dahilan kung bakit tayo nahihilo? Number one is benign paroxysmal positional vertigo. Yung medication na tinitake nyo, make sure you check yung side effects niya. Number three is if you have inner ear infection, or such as vestibular neuritis or labyrinthitis, or if there's any tumor na nagkukos ng compression sa ating or acoustic neuroma sa vestibular nerve. Yung mga central component naman such as multiple sclerosis, stroke, or any tumor na nagko-compress sa ating brain, it can lead to vestibular dysfunction or central component. Ang pinaka-common naman po dito ay yung mga inner ear problem. Bihira yung mga nabanggit ko, like yung mga inner ear infection, common siya, and yung vertigo or benign paroxysmal positional vertigo. Ang matututunan nyo sa video na ito ay paano i-treat ang chronic dizziness secondary to vestibular hypofunction, yung unilateral vestibular hypofunction. For example, yung nagkaroon tayo ng inner ear infection sa each ear, like one of the ears. Alright, so nagkaroon ako ng weakness dito dahil nagkaroon tayo ng infection. Let's say this ear, okay? Kung may weak ito dahil nagkaroon ako ng inner ear infection and then this one is normal, ang signals na nagpupunta sa brain ay hindi pantay. Alright? Asymmetry, hindi siya pantay. So, every time I move my head, I get dizzy kasi weak itong side na ito, normal ito. So, nagsasend ng signals sa ating brain, ang ating vestibular nerve, dito mahina, dito malakas. So, nagkakaroon ng error signal. So, when I turn my head here, it's not symmetric. Alright? So, posible na when I turn my head here, this ear is firing towards this side. And then I'm moving my head here, but it's thinking it's moving my head here. So that's one of the reason bakit tayo nagkakaroon ng dizziness or visual blurring. Isa sa mga symptoms ng vestibular dysfunction or hypofunction, vestibular hypofunction secondary to weakness of yung weakness ka dito sa right ear or left ear, nagkakaroon ng hypofunction. So, nagkakaroon tayo ng visual blurring. So, isa sa mga exercise na ituturo ko sa inyo, paano tayo mabawasan niya through adaptation exercise and habituation exercise. Yan. Ang isa namang dahilan kung bakit tayo nahihilo ay dahil 65 years old and older, 65 years old and older, ito ang pinaka-common. Ito yung tinatawag na BPPV or benign paroxysmal positional vertigo. Itong mga crystals na ito, microscopic crystals. Saka yung mga inner ear canals niya, maliliit. Ano? So yung ear canals natin, we have 3 here and then we have 3 here. So all in all, 6 canals. Ito, for example, ito yung right ear ko. Alright? Ito yung canal na sinasabi ko sa inyo. Yan yung mga semicircular canals. Yan. Sa semicircular canals, may fluid dyan. So, when I look down, yung movement of fluid, nadidetect niya pababa or pataas or pa sideways. Okay? So, kung nagkaroon tayo ng problema dahil na-displace or na-dislodge yung crystals dito sa posterior canal natin, dyan sa canal na yan, okay, magkakaroon tayo ng tinatawag na vertigo. Alright? So, itong canal na ito. Yan. Isa sa mga canal dyan, yung posterior canal. Again, ayan. Ayan ang canals na makikita sa loob ng ear natin. That's your semicircular canals. So, kung na-displace ang crystals to one of the canals and na-dislodge siya, may mga hair cells tayo dyan or hair, tiny hairs. So, pagka nag-move yung crystals, tumama doon sa tiny hairs natin sa inside ng semicircular canal, nagkikreate tayo ng confusion of signals. So, nagkakaroon tayo ngayon ng vertigo. Pagka sinabing vertigo, it's a symptom, no? Ibig sabihin, the room spinning. Yan, nahihilo, makikita, mararamdaman nyo. So, nakakatakot talaga siya. Akala ng mga pasyente ko, they had a stroke. Pero it's a simple, madali lang i-treat ang benign paroxysmal positional vertigo. Okay? Mamaya ipapakita ko sa video na ito. Ngayon, itong mga exercises na ituturo ko sa inyo, ito yung ginagamit ko sa Reyes Physical Therapy. Ipapakita ko sa inyo ang adaptation exercise. Itong adaptation exercise, ginagamit sa mga may chronic dizziness, yung laging nahihilo. Okay? Ang adaptation exercise, ginagamit natin ang vestibular ocular reflex. So, gamit lang kayo ng pen or you can use your thumb right here. Ang vestibular ocular reflex, ang idea nito, adaptation. So, ang nangyayari, repetitive movements. So, weak itong side na ito and strong here. Nag-a-adapt ngayon, nagkakaroon ng correction. Nagsasend ng error signal sa brain. The more we do yung exercise na to, nasasanay na ngayon, nag-a-adapt na ang ating brain para mag-improve ang ating condition. Again, you have to do this consistently. May hilo kayo dito, but hindi naman yung sobrang hilo. Kailangan ma-provoke yung dizziness niya. Kasi kung hindi nyo challenge, hindi magkakaroon ng magandang signals or adaptation. Kailangan kahit papano may konting hilo dyan, and then dahan-dahan lang. Okay? So, normal na mahilo, pero wag naman sobra. You're gonna start with 30 seconds. Yan, ganyan. Nakikita nyo, nakatingin lang ako dito sa aking target. Yan, 30 seconds, side to side. Ganyan. Pwedeng mabagal, pwedeng mabilis. Pero start kayo ng mabagal. Yan ang inyong adaptation exercise. Now, after doing side to side, you're gonna do up and down. Alright, watch my eyes. I'm looking at the target. Yan ang ating adaptation exercise. Okay, so normal lang na may hilo. Wag naman sobrang pagkahilo. So again, side to side. You do this for 30 seconds. And you do this every day, 3 times a day. Now, up and down for 30 seconds. Okay? So, yan yung dalawang exercise na gagawin nyo. Another one is following the target. Alright? This is what we call VOR cancellation. Mamaya ituturo ni Caroline ito. Okay? Akin naman, we're gonna do some circular motion. Again, this one, I like to do this 10 repetitions. And then you go the opposite side. Okay? Circular motion. Okay, so that's 10 repetitions gawin nyo. And then you can close your eyes and you turn your head side to side. 10 repetitions and then up and down with your eyes closed. Okay? So, yan po ang ating exercise. Last adaptation exercise, you're doing, pwedeng, yan, tingnan nyo ang aking mga mata. You're just looking to the right and then turn. Looking to the left, turn. Eyes first and then turn. Eyes. Let's do this 10 repetitions. Ito, mahirap tong exercise na to. Gagawin nyo ito pag sanay na kayo sa first exercise na yan. Alright? Just do 10 repetitions. Side to side, yan po ang ating mga vestibular adaptation exercise. Mamaya, ipapakita ko sa inyo kung paano gawin ang Epley's maneuver left and right. So, kung meron kayong left ear BPPV, makikita nyo sa video na ito kung paano i-treat yung left ear BPPV and then the right ear BPPV. Okay? So, we're gonna do, Caroline, you're gonna do 10 repetitions side to side, okay? Good. And you can go faster, but start slowly first. And then as you get better, you can do faster movements. Okay, let's show 2 more. And good. Rest. And now you're going to be doing up and down, Caroline. So you're going to be moving the pen up. Good. And down. So again, 10 repetitions. Excellent. And she's going to be doing 3 more times. And good. Excellent. Good job. Now, Caroline, you're going to be doing head turns side to side. Okay, head turns side to side. Good. And again, we're going to be doing 10 repetitions doing this. 10 repetitions. Excellent. Again, you can do it slowly and then progress to moving it faster. And try to do faster, Caroline. Good. So this one, the key here is we're not gonna make the patients get dizzier. What we're trying to do is stimulate the dizziness, and through repetitions, the patients are slowly gonna get better by doing repetitive or repetition of movements. All right, good. And now you're gonna do up and down, Caroline. Okay, up and down, 10 repetitions. Again, you can start slowly and then faster. By doing this in repetitions, you're provoking the dizziness, and by doing it over and over again, repetitive stimuli, that's gonna adapt. The brain is gonna adapt, or the brain is gonna habituate from this movement. This is actually habituation exercise. Okay, stop. Okay, you're gonna do eyes closed too. Gagawin natin eyes closed. So Caroline's gonna close her eyes, and then you're gonna move your head side to side. Okay. And so we're closing. Sarado yung mata, and she's doing head turn side to side, again to stimulate vestibular, your vestibular system. Dizziness it depends on what provokes the dizziness. If this one provokes your dizziness, kung ito nagpo-provoke ng dizziness nyo, you continue doing this over and over again. Again, repetition is the key. Okay, just 10 repetitions in this, and stop, Caroline. All right, good job. All right, now the next step is with your eyes closed, you're moving your head up and down, okay? Again, she's doing it slowly. And if this one doesn't provoke your dizziness, you don't need to do this. We want the exercise provoking the dizziness. Again, habituation exercise, we have to find what makes you dizzy, and we do it over and over again. Ibig sabihin po nito, alamin ko ano yung what makes you dizzy, and you do it over and over again. So that's an habituation exercise. Okay, so Caroline is going to show us how to do self-treatment, right BPPV, right Epley's maneuver for right BPPV. Caroline, all right, swing your legs to the table. Okay. Again, she's gonna turn her head to the right side, 45 degrees, just like that. Arms across the chest, and she's gonna lie down, maintaining her head into that 45 degrees. You can do this faster, but this one is just for to show you how we can perform this. All right. So 45 degrees. Hold it for 30 seconds to a minute, until the symptoms of dizziness subside. After holding it for 30 seconds to a minute, mag-turn ka, Caroline, you're gonna turn your head to the left, all right? So, mag-turn tayo to the left, okay? Hold it for 30 seconds to a minute until the symptoms subside, all right? So, after 30 seconds to a minute, magro-roll tayo to the side, okay? Roll to the side, and maintain your head so as if you're looking down to the floor at 90 degrees, just like that. Good job, Caroline. And hold it for 30 seconds to a minute until the symptoms subside. And Now, after 30 seconds to a minute, she's gonna slowly sit up, okay? Slowly sit up and maintain that head, the position of the head into a 90 degrees and then, okay, and then sit up slowly and back to. Now, on this one, we're gonna start with, Caroline is gonna show us how to do left Epley's maneuver. Now, ito yung mga nahihilo or may diagnosis ng left BPPV or benign paroxysmal positional vertigo sa left side. Now, put your legs to the table. Now, with this one, she's gonna turn her head to the left. All right, so she's gonna lie down, arms across the chest. She's gonna lie down. Maintain the head into a 45 degrees range of motion. Hold it for 30 seconds to a minute. After holding it for 30 seconds a minute until the symptoms subside, she's gonna move her head to the right side. Ilalagay po ninyo ang inyong ulo to the right side, 45 degrees range of motion. Maintain po natin ng 30 seconds to a minute until the symptoms subside. Now, Caroline, you're gonna roll to your right side and, okay, and then your head should be 90 degrees or your nose is pointing down 90 degrees, okay? So as if you're looking down the floor, kailangan po 90 degrees po yan. All right, and then after 30 seconds to a minute until the symptoms subside, she's gonna maintain your head just like that. She's gonna sit up slowly while maintaining your head in that position. Okay, once you're in neutral position, once you're sitting up, you can put your head in neutral position.